How to sleep fast with insomnia? Do this and sleep will come in 2 minutes. In this video, I will tell you what prevents a good sleep and how to deal with it. I will also tell about the fact that when a person starts to fight insomnia, he makes a series of logical mistakes that further exacerbate insomnia. A vicious circle emerges. Some provocative reason insomnia, a person starts to fight it. There is such an expression that there will be no war, but there will be such a struggle for peace that no stone will be left unturned. So the struggle with this insomnia can sometimes be more destructive for a person than the insomnia itself. I will give a few good tips that will help deal with insomnia much faster, easier, and without these heavy consequences for a person. Watch this video to the end and you will learn what myths about sleep are, why they interfere with our sleep, and how to deal with them. Something provoked a bad sleep in a person. Well, now we have stress to spare. It's the most common cause. Banal stress and sleep disturbance. There is even such a term as reactive sleep. Some people react specifically to sleep disturbance by getting stressed. The classic picture is when a person just woke up and can't fall asleep, or even anticipating some event, and it doesn't necessarily have to be a bad one. For example, you could be anticipating a wedding and not sleep all night, or waiting for a birthday and not sleep all night in anticipation. This is what we call reactive sleep, when our mental arousal deteriorates the quality of sleep. But at some point in life, we encounter a lingering stressful situation that deteriorates our sleep almost every day. And here, unfortunately, a vicious cycle is triggered, where a person struggles with insomnia, but makes logical mistakes that further exacerbate the insomnia. First, a person lies down, can't fall asleep. What does he do? He tries 1 night, 2 nights, 3 nights. Enough. 2-3 weeks of trying and not sleeping, a person develops a strong conditioned reflex of fear of not sleeping. And the problem is that even the very cause that initially caused the sleep disorder can pass, but the established reflex remains. And a person may want to sleep, but as soon as he decides to go to bed, that's it. Sleep is gone like a hand wave. This is a typical display of the conditioned fear reflex of insomnia. Next, where is someone when they're attempting to sleep? In bed. And the bed itself begins to be associated with insomnia. A healthy person, put to bed, will doze off in 15 minutes, fall asleep in half an hour, even if he didn't want to sleep. Because he thinks, oh, my dear pillow, mattress, and the bed in general, it's sleep, and he falls asleep beautifully. What if someone has developed a fear of insomnia? They go to bed, already worried about not falling asleep. They criticize their mattress and pillow, complain about the lighting and airflow, and resent their partner who snores peacefully. And the ingrained conditioned reflex does not allow a person to sleep normally. And at the next stage, our sleep itself represents such a cyclical process, and every 2 hours we have a cycle of sleep repeating. First, second, third stage, then rapid eye movement sleep, dreaming, and then physiological arousal. Any healthy person wakes up 3-4 times a night in such a way that it reaches their consciousness. He briefly opens his eyes, shifting and changing position. For example, we notice he wakes up during studies. We asked him in the morning if he woke up. He said no. Now imagine what happens to a person who has developed a fear reflex of not falling asleep. The bed insomniac. If he wakes up physically after 2 hours and this reaches his consciousness, what is he thinking? Oh, horror, nightmare, catastrophe, I can't sleep. It awakens the person, stress reaction. The person wakes up and can't, let's say, sleep for 10 minutes, 15 minutes, 20 minutes. By the way, give a like to this video if what I'm saying resonates with what you're feeling. Write maybe in the comments if you've developed a fear of not being able to sleep, a bed insomniac, or how often you wake up in the middle of the night, and I read all of this, and I'll try maybe to give some comments on how to deal with this. So moving on, a person starts waking up in the middle of the night. There are problems with falling asleep, waking up in the middle of the night. What's on someone's mind? Oh no, I can't sleep. You need to try to get some sleep. You need to go to bed earlier and get up later. Catch up on sleep during the weekends, and if feasible, nap in the afternoon. That is, somehow spend more time in bed trying to fall asleep and somehow get your sleep. It doesn't happen that a person, for example, has a good 8 hours of sleep and then just lounges in bed for an extra 3 hours. If he lies in bed for, say, 11 hours, then the 8 hours sleep is spread over all these 11 hours. There will be even more problems with falling asleep. waking up in the middle of the night. There won't be 3, 4 of them. There will be 10, 15, 20, 30. That is, predictably, these extra 3 hours that a person spends in bed, they still won't sleep, but it will all spread over the entire sleep. And then the next huge problem arises. A person doesn't remember when they sleep. He closes his eyes, and when he opens them, it's morning, indicating a good sleep. He can't recall his sleep, but remembers his sleeplessness. And if a person woke up 30 times during the night, he will remember how he fell asleep, how the neighbor was making noise, how the door creaked, how the birds started singing, how the cars started moving, how the sun rose. That is, he will have a feeling of almost complete insomnia because of these frequent awakenings. And what does a person think? Well, I used to lie in bed for 8 hours and it was enough for me. I'm in bed for 11 hours but only sleep for 1 to 3 hours. I don't get sufficient sleep. And at the same time, a person like this can't fall asleep during the day. Why? Because he actually gets his sleep at night. Yes, it's disrupted and not top-notch, but it's adequate overall. Sometimes a person even oversleeps at night more than necessary. Hence, an insomniac says, "Doctor, it's paradoxical. I once slept at night and napped in the day, but now I can't sleep at all, and I fear I might die soon. Please prescribe a pill urgently." And this is the situation that ultimately leads to a person starting to perceive sleep as a disease. More stress hormone is produced at night, adrenaline, cortisol, sleep becomes super light. Something happened somewhere, a fly passed, eyes are open. The neighbor rolled over, eyes open. Something creaked, eyes opened. That is, a person starts to have super light sleep. Next, the individual might say, "Doctor, I haven't slept for 3 days, 2 weeks, or even a month." Although in reality he sleeps, but thinks that he does not sleep. Such a phenomenon of sleep perception disorder. And at the final stage, so-called sleep deprivation catastrophe. That is, I always talk to patients. I say, listen, how does a person feel who thinks he has brain cancer? Well, the person says, well, in general, of course, it doesn't matter. They urge him, like, what's this about? Compose yourself. Let's take a walk. They're asking about the walk. This is the third time I'm rescheduling the meeting. It's known as hypochondriac syndrome, where a person believes everything is awful and they're about to die. So that's how a person develops hypochondriac syndrome in response to such insomnia. And the person thinks that's it. Their life is over, that it's just a catastrophe, that nothing helps. And this in itself further de-adapts the person because they start experiencing endless horror again. And stress, anxiety, depression, and unfortunately, it's very difficult to get out of this vicious circle. But it's possible. And I will give recommendations on what to do with this. And the most effective way to treat insomnia, you'll be surprised, is sleep restriction. More precisely, by limiting time in bed. When a patient with insomnia comes to me, or a female patient, and says, "Doctor, I'm in bed for 10, 11 hours, but I only sleep for 5. And of course, severe insomnia. I ask, how much did you get before the insomnia? The man states 7. So we limit your time in bed, for example, to 6 hours. What is this? How so? You admitted yourself that you only sleep 5 hours. I didn't have to pry. I'm giving you an additional hour. But what really happens? I'm actually limiting a person's time below what they need to get enough sleep. That is, a real sleep deficit will start to form. Because when a person lies in bed for 10, 11 hours, they oversleep. They sleep too much. Why doesn't daytime sleepiness happen later, by the way? Obviously, oversleeping can lead to difficulty falling asleep the next night due to the fear-induced reflex of insomnia. But if we limit a person's time in bed to less than the physiological norm, the person begins to accumulate a real sleep deficit. I tell them that they're basically gathering a sleep elixir. And at some stage of sleepiness growth, whatever the reflex is, fears of not falling asleep, a person with the thought, oh, I didn't fall asleep now, falls into bed and falls asleep. I'd say, after about a week or so of this routine, a person talks like they're sleep deprived. I, for one, realize that it's nearly impossible to function without sleep, doctor. And it turns out that I can sleep, and I'm just waiting to get to this bed, but you won't let me sleep. And when I add 15 minutes of bed rest after a week or two, the person says, "Doctor, thank you very much." And I only added 15 minutes. And yes, I gradually increased the bed rest time, but I never let the person sleep off at once. If he slept, his reflexes would come back. But it takes 3 weeks of sleep deficit for a conditioned positive reflex to form. Indeed, as a negative forms in 3 weeks, so does a positive in 3 weeks. And a person will think, oh, my dear bed, mattress, pillow, how well we are together. Thus, we can literally teach a person to sleep normally again in a short period of time. Yes, friends, I recently wrote a mini book dedicated to stress as the main cause, by the way, of insomnia. And there are clear and understandable recommendations on how, first of all, to determine your level of stress and the severity of insomnia. And secondly, what to do to deal with it very effectively. In the description of this video, you can find a link to this book. And another technique that complements the sleep restriction technique is limiting the time spent in bed without sleep. That is, if a person lies down and does not fall asleep within 15 minutes, he should get up, go to another room, and not lie down until he really wants to sleep. That is, we need to develop the following reflex that the bed means sleep. A person says, but how will I get up? I will leave, I won't sleep, and I need to get up in 6 hours after staying in bed. I say, yes, you will accumulate additional sleep deficit, and in the end, you will still fall asleep. And in the end, a person starts to lie down and literally falls asleep in 5 to 3 minutes. That is, these seemingly simple techniques of limiting sleep and time spent in bed without sleep allow to quickly improve the quality of sleep, improve falling asleep, and remove the reflex fear of falling asleep and insomnia. What is also extraordinarily important, it is necessary to eliminate daytime sleep. It would seem, the person says again, Doctor, well, how so? I didn't sleep at night. I can at least catch up during the day. Yes, you caught up during the day, but this will still disturb your sleep process in the evening. In this sense, if we talk about daytime sleep, yes, it can be beneficial from one side if it is short enough. Well, 20-30 minutes, it refreshes and allows you to work in the evening, or somehow actively spend the second half of the day. But at the same time, it does not interfere with falling asleep and does not disrupt night sleep. Yes, please, you can sleep during the day. And now I am debunking myths that you, first of all, know. And secondly, probably act in accordance with these myths, which worsen your sleep. The most popular myth is that sleep before 12 is more beneficial than after 12. That supposedly melatonin is produced and some other exchange processes are going on. And if we go to sleep after 12, then the quality of our sleep is much worse. Once again, this is a myth. The main thing is to follow the regime. You can go to bed at 10 in the evening and get up at 6 in the morning. You can go to bed at 2 in the morning and get up at 10 in the morning. It's important to maintain a regime, the overall duration of sleep, which is necessary for you to get a good rest, and also what is called light accompaniment. That is, when you sleep, it should be dark, and when you are awake, it should be light. And with the help of artificial lighting, we can completely deceive our body, and it will live exactly under the hours we set for it. Another myth is that sleeping pills, valerian, and so on are good sleep aids. In general, I want to say that if you believe in some placebo, drank it, and fell asleep, yes, the placebo effect worked. Interestingly, it's typically short here. I was advised to consume a herbal concoction, which initially worked well, but ceased to be effective after a week at most. These are classic manifestations of the placebo effect, which quickly stops working. What can be said about these preparations? They have a calming but not sleep-inducing effect. Therefore, they should be taken not before sleep, but in a course of 3 times a day. The nervous system becomes more stable, and as a result, a person sleeps better. This is their direct pharmacological action. What methods help you sleep better? Please write in the comments, and I will read all of this from my side and maybe comment something in response. Another myth, unfortunately supported by pharmaceutical companies and even doctors, is that chronic insomnia can be cured with sleeping pills. You may wonder, given that nearly all doctors prescribe these drugs, how is this possible? Alas, most doctors do not know how to treat chronic insomnia. In fact, if we have a sleep disorder, a symptom of insomnia, it would seem that a sleeping pill would work. Yes, while you are taking it, it can remove this insomnia. But with chronic insomnia, there is some reason that caused this insomnia. And just removing the symptom, well, I'm always compared to antipyretics. If you've had a fever for 3 days and taken an antipyretic, it's probably an acute respiratory infection, which typically resolves in a week. And if you have a high temperature for 3 months and you just keep giving antipyretics, the person might have tuberculosis, or he might have some kind of tumor, or some serious systemic diseases, from which he can simply die, and you will be symptomatically reducing the temperature. So, with insomnia, prescribing chronic sleep aids, we remove the symptom, but physical and psychological dependence on sleep aids develops, and with prolonged use, the sleep aids themselves further deteriorate the quality of sleep. And the cancellation of these sleep aids leads to a recurrence of insomnia, to the phenomenon of so-called withdrawal, when it gets even worse than it was. For chronic insomnia, it's essential not just to give a sleep aid, but to thoroughly examine, accurately diagnose, treat the cause, and then, probably, there won't be a need for a sleep aid. And of course, the most common remedy that our people use to sleep better is alcohol. As strange as it may seem, there is, of course, a general opinion that alcohol is harmful. And in large quantities, I will say this. Naturally, it's harmful and worsens sleep quality. But interestingly, on cigarettes they write, smoking is harmful to your health. Any dose of nicotine is harmful. And on bottles with alcohol they write, excessive alcohol consumption is harmful. Excessive alcohol consumption is harmful to your health. If we take a relatively healthy adult, then the dose of alcohol up to 1 fluid ounce of pure spirit, that's approximately 208.8 ounces of dry wine. It has a tranquilizing, calming effect and can also potentially improve sleep. Still, they would say that any dose of alcohol is not very beneficial. Listen, are all herbs beneficial? You've read the instructions. They list potential side effects and complications. And sleeping pills, too. There's a saying by an Englishman that no one has ever died from insomnia, but thousands die from sleeping pills. This, too, is an issue, always needing to balance benefits and risks. So, returning to alcohol, small doses are potentially possible situationally to slightly reduce stress. But large doses, the alcohol itself is consumed faster, but the metabolites of acetaldehyde, they have an exciting and toxic effect. And there is such an expression, the sleep of an alcoholic is short and restless. A person falls asleep quickly, but wakes up midnight, restless and uncomfortable. Moreover, alcohol also exacerbates obstructive sleep, apnea syndrome, and nocturnal hypoxia. In a separate video, I have a lot of information about sleep apnea. And if you have severe sleep apnea and a large dose of alcohol, you can simply die in your sleep in this situation if you are going to consume a large dose of alcohol with sleep apnea. Dear friends, in this way I have explained, firstly, how conditional negative reflexes are formed and how to deal with them. We have debunked some myths and also how to deal with them. And I hope this will significantly improve the quality of your sleep if you apply these recommendations in your life.